My mom was a doctor, and that was pretty much it. You know, she was a doctor, and growing up, you know, she was at work a lot. And as I grew up and got older, I understood it, and I saw her passion for medicine, and I saw how she treated her patients. I saw her as my role model, and like that, the die was cast. Cardiac electrophysiology, it's a very focused field. I think for me, it's a fascinating field. It's very interesting. You know, you have to be a very detail-oriented person. You have to understand this really complicated, really amazing organ, the heart, and specifically the heart rhythm and how that works. So it's amazing to be able to study something, understand it, enjoy it, and then be able to put that into practice and do something that's meaningful and, you know, something that can really help, you know, patients. You need to understand what's going on with the patient before you can come up with the right way to treat them. And so the most of my visit is just tell me what's going on. And I hope that, you know, my patient is doing most of the talking. And I try mostly to just get a sense of what's been happening. And then the second part is sort of, here's where we can go. Here's where we can take it. Here's what we're able to offer. And then the third part is, you know, what we kind of call shared decision making. You shouldn't be forcing patients or telling them what to do, but you do need to be there as sort of a guide and to, you know, to try and steer people in a way that aligns with what they want and also with what you think and know is the best thing for them. And so we come up with a plan. The most rewarding part for sure is when you see the patient in follow-up and they say, you know, doc, I feel so much better. But ultimately, the end point of all of this and the reason we do all this is so that when the patient comes back, they feel better and you've potentially even saved their life or just made a massive improvement in their quality of life. That's what it's about.